Your call. Going on second decade now. So I am going to talk about high blood pressures today and how do we become healthy despite a diagnosis of high blood pressure. First, what is high blood pressure? In the simplest terms, it is the blood force that is pushing against the arteries in our body. Our body is made up of this complex artery and veins and the heart in the simplest terms. The arteries bring the blood away from the heart and the veins bring the blood back into the heart. That high blood pressure is related to the blood coming out of the heart and now pushing against these arteries in our bodies. When is it considered a high blood pressure? When the blood pressure measurement is at or over 130 over 80 milligram per mercury, that's when it is defined as a high blood pressure. And you're going to ask, why is this the case? And that's because according to the American College of Cardiology and American Heart Association guideline, which was put forth in 2017 and published in this Journal of Hypertension a few months later, mid part of June 2018, that specific definition is needed in order for somebody to be diagnosed with high blood pressure, or sometimes called hypertension in the medical language and billing and coding. This is in simple table format what's considered high blood pressure. High blood pressure is from 130 or above for the systolic blood pressure, and for the diastolic, the bottom number is 80 or above. Now, in between, and you have heard this before, I'm sure, the target of that 120 and 80, according to the guideline from 2017, if the blood pressure is between 120 to 129 or 79 or below, that would be considered elevated blood pressure. Not quite the high blood pressure, but just the elevated high blood pressure. And normal would be 119 or below in the systolic, the top number, and 79 or below in the diastolic number. And the next slide reminds me that I wanted to show you this video that Marilyn actually had helped me see if it's going to work for us today. So it's a beautiful one, actually. I really liked it. So hopefully you will like it as well. So Marilyn will help me right now. We'll put it on the screen.
Are you going to pull the video up?
Yeah.
Okay.
I'm just about ready to pull it up. You see that, Marilyn?
Yep. Go ahead and turn it on.
Here we go.
Size of your fist. As you know, it pumps blood to your body through a network of pipes called blood vessels.
So, Miriam, it's not as loud as it was when we tested it.
Okay, let's make it louder, okay?
Yep. I can't do anything more on my side.
Okay, maybe it's me on my side.
Yep, everything's as high as I can get it.
Okay, let's try it, okay?
We're on the same page. All right, your heart is a muscle about the size of your fist. As you know, it pumps blood to your body through a network of pipes called blood vessels. And blood pressure is the force the blood puts on your vessels as it pulses through them. It's measured with two numbers. Okay, let's say your blood pressure is something like 140 over 90. The top number is the force of blood against the vessels when the heart pumps. And the bottom number is found when the heart is at rest between each beat. You may hear the top number called systolic and the bottom number diastolic. But what's important is when these numbers are too high, it can lead to all kinds of health problems later on. And I'll tell you more about that in a little bit. But right now, you may be wondering, why me? Why do I have this? Well, hypertension is pretty common. Most likely, it runs in your family. And it's more common in African Americans. Also, things like weight, diet, and how active you are can play a
I
role.
can't change it.
Other
We
medical
find
conditions.
this. If you can't hear,
A lot
bring
of
your shirt.
alcohol can raise blood pressure. Stress, depression, sleep problems, and something called sleep apnea can also raise it. So let your doctor know if you have trouble with any of these. And let your doctor know if you snore a lot or if your partner says you snore a lot. Now, it's important to know most of the time people cannot feel high blood pressure. In fact, a lot of people have hypertension for years and don't know it because they don't feel a thing. But even if you feel okay over time, hypertension can seriously damage your body. So it's best to do what you can now to keep it under control. Start by finding out what your blood pressure goal is. For example, some doctors may recommend a goal that's something like 130 over 80. And if either one of these numbers is higher, your blood pressure is high. So if this was your goal, your blood pressure would be high if the top number was more than 130, or if the bottom number was more than 80. But again, find out what your blood pressure goal is. It can be different for different people.
Thank you for your patience. And so that video clip shared some basics about hypertension. Dr. De La Cruz and Dr. Knighton already shared with you a very nice brochure from the NIH and the NHLBI. So let's look at in detail what else can we look at together as we go through the program. So there are risk factors. Some of them are modifiable, meaning we can change it, and some of them are non-modifiable. You probably have seen in that video clip that lifestyle habits can make a difference. I got to fess up, occasionally I have some unhealthy diet, occasionally. Sometimes we eat too much salt, too much fat. Weight is also an issue. Folks who are overweight and in some cases obesity, sometimes people have thyroid disease and so they can gain so much weight and it's difficult to remove it from their bodies, or sometimes from medications. That could also be a harbinger of high blood pressure. Too much alcohol can also cause high blood pressure, and other things like smoking, stress, lack of exercise, and lack of sleep, as mentioned in the video. There are also those things that are non-modifiable. Age. As people age, like many of my patients, because I'm a geriatrician, as people age, there's a higher number of people with high blood pressure. Genes, unfortunately, we're also born with it from many a time. Race, I'm Filipino, and I know a lot of Filipinos have high blood pressure. Family history, and then sex as well. Men are higher in numbers with high blood pressure before 60 years old, but after 60 years old, there's an increase in the number of women who are diagnosed with high blood pressure. Is there anything you could do about it? What can I do to change this? Yes, there is. Eating healthy foods, such as low salt and low saturated fat. You can see the beautiful picture here of fruits and vegetables. This is from the CDC, the Centers for Disease Control. And what they're showing are those healthy foods. I have a nutritionist friend who said to me that, Miriam, the more colorful your food is, the healthier it's going to be. And so look how colorful that picture is from the CDC. Moving more, the Linda Health Promotion Program. Line dancing is excellent. Why? Because it's physical activity. It can help you move more. And again, in the brochure that Dr. Dela Cruz and Dr. Knighton had shared, it shows there that even only half an hour activity, walking, cycling, or hopefully a lot of dancing that you can carry out 30 minutes per day, 2.5 hours per week, would also help in controlling your blood pressure and aiming for a healthy weight as well. Normally, there is what's called a basal metabolic index, BMI, and for that, for a particular height and weight, there is a specific BMI that we should be at. Of course, there are negatives and positives about that value, but essentially, if we could prevent being overweight, then that would be a good thing as well. Managing stress is also important for all of us, whether you're stressed in the home, in the family, at work. We all need to kind of tone down the stress that we are up against in our daily living. Smoking also increases high blood pressure. So stopping or quitting use of cigarettes or smoking is very important. Nowadays, because of the social media and cell phones, smartphones, there are modern ways now by which, this is also from smokefree.gov, that I also was able to tap from the CDC. There are different ways by which one can get involved and use tools for stopping smoking, such as the smoke-free social media, smoke-free apps, smoke-free texting programs, and there's other medications as well that you can ask a doctor to help you with in prescribing for you. Less alcohol drink. It also helps if people will drink a whole lot less, or maybe not even drinking at all, because it does have blood if high blood pressure effects. Are there complications? Yes, and I see this a lot. I see this a lot in my patients because I usually would take care of people at the tail end of the age groups, 65 and above. One of the concerns that I have with high blood pressure is that when my patients don't feel anything, meaning it's asymptomatic, there's no headache, there's no dizziness, they would think they have no high blood pressure, which makes sense, right? I'm not feeling dizzy. I don't have double vision. I'm not fainting. So I don't have high blood pressure, right? Because the person is asymptomatic. But the problem with that is the body knows it. And over time, the chronicity of the high blood pressure will have end organ damage. The three big organs that it will affect would be the heart and the cardiovascular system, the kidneys, and then the brain. With the heart, I see so many types of complications, such as heart failure, the left ventricular hypertrophy, meaning the left ventricle, there are 4 chambers of the heart, and this is the lower one. Because it's pumping so hard against the blood vessels that are often laden with high cholesterol, then it becomes so huge. And then it's got more structural issues that ensue after that. I see a lot of complications in the heart system. The other thing that I really see, and this is insidious, you don't even see it, meaning it is so asymptomatic, people don't feel anything about it, and yet their kidney becomes functioning so much lesser, so much less normal over time. And that's called the chronic kidney disease. And at its worst, if you know of some people who have dialysis, at that point, their kidneys are shot and they need the dialysis to help them cleanse the blood with all of those metabolites that are toxic to the body. Diabetes complications as well is another big one that happens when high blood pressure is not controlled. The brain, this is huge. This is huge. The brain is also affected by uncontrolled high blood pressure. Over time, and I see this over and over and over again with my patients, the most deadly, if it causes death, is stroke. Not only is it going to cause, not only could it become fatal, but it also causes disability. If someone ends up with a stroke because of uncontrolled high blood pressure, that is something that we all must think about. Even though we don't feel the symptoms, it is imperative that we control the high blood pressure so that my patients and I and you, all the people around us, will not end up with a stroke and disability. Dementia. There was a study in Hawaii, actually, where they had looked at the control of blood pressure in the middle age group. And they followed this group, this cohort over time. Those people who had very well controlled blood pressure had less incidence of dementia versus those who had uncontrolled high blood pressure. Not only does it increase the propensity for dementia when it's uncontrolled, when people are younger, but I see it too often in the people that I look after, that potentially it can affect the vision. Potentially it can affect the gait or balance, as well as the mobility of people. So it does have complications. And so I can't overemphasize how important it is to make sure that everybody, your families, your friends, your relatives, would control the blood pressure and make it as normal as could be within that normal range that you would talk about with your primary care provider. There are things that you can do. You can take heart. There are things that you can control. There are modifiable factors. And line dancing is one option in which you can increase your movement. I'm happy to take questions. If we have time, that is Marilyn, Dr. Philly. If not, it's okay.
We have time. So do you want to take your slides down so we can see your beautiful smile and face?
Sure, I'll stop sharing. Hello, everybody.
I'm going to see if I can make you speaker view. So what questions do you guys have?
Wow, it's a lot. Right.
It's a lot to think about, they're saying.
Yeah, and I'm happy to come back again for a Q&A. We can do that, Marilyn, at some point if time permits.
Yeah, well, we have probably about 20 minutes before our line dancing instructor comes. So does anybody have questions?
I can talk more about dementia. I can talk about kidney. I can talk from the heart. I can show you another video. Actually, there's a video that I prepared for you.
Yeah, they want to see the video.
Yeah, the video is lovely, actually. I really had thought about you because, as I said, I love working with Marilyn and the health ministry friends. And I looked at some really beautiful videos. So Marilyn, let me share something from the NIH, the National Institute of Health. They're really good videos. So let me share
You're
that.
setting that up.
I'll set it up, yeah.
we're recording this, so if there were things that you didn't hear, we'll get the recording to you so that you can go ahead and, listen to it again.
We're gonna do via email.
Can we send them?
Yes, yes.
Okay.
I'm sorry, what was your question?
Via email.
We will send, if you have an email, we'll send you these slides.
Thank you.
We'll send you the recording.
Yeah.
Yeah.
So you don't have an email. Let me see what I can do.
Do you have a cell phone? All right, so we can send the recording by cell phone, and you should be able to click on it and be able to hear it. There will be a code that's required to get into it, but we'll send you the code along with it. You ready, Miriam?
Yeah, and let me know. You can give me a thumbs up or a smile, and if it is working, okay. If not, I'll stop. And then this is another beautiful video actually from the NIH. So let me put it in, okay.
The force of blood on artery walls is called blood pressure. Normal pressure is important for the proper flow of blood from the heart to the body's organs and tissues. Each heartbeat forces blood to the rest of the body. Near the heart, pressure is higher, and away from it, lower. Blood pressure depends on many things, including how much blood the heart is pumping and the diameter of the arteries the blood is moving through. Generally, the more blood that's pumped and the narrower the artery, the higher the pressure is. Blood pressure is measured both as the heart contracts, which is called systole, and as it relaxes, which is called diastole. Systolic blood pressure is measured when the heart ventricles contract. Diastolic blood pressure is measured when the heart ventricles relax. A systolic pressure of 115 millimeters of mercury is considered normal, as is a diastolic pressure of 70. Commonly, this pressure would be stated as 115/70. Stressful situations can temporarily cause blood pressure to rise. If a person has a consistent blood pressure reading of 140/90, he would be evaluated for high blood pressure. Left untreated, high blood pressure can damage important organs, such as the brain and kidneys, as well as lead to a stroke.
So, questions, comments? Feel free to speak up, and I'll, if Miriam can't hear, I'll repeat it.
Maybe I can review some of the highlights of the talk.
Okay, we have a question in the back.
I'm sorry, this is in relation to the blood pressure measurement that was indicated that if your blood pressure is 120/80 or 120 systolic, you're already considered elevated. However, myself, per my experience, if I go to doctor's office or if I read books and whatever supplements from the doctor's office, I still read and see a blood pressure of 120/80 or less as normal. So it's like, I'm just wondering if my blood pressure had been elevated in the beginning, I was not told about it. So I am of the impression that if my blood pressure is 120/80, I'm okay. So I can liberally eat or whatever I do.
So let me explain
So,
what has happened with those numbers.
Kelly, she's asking the question of Dr. Schwartz.
okay.
So so the question is, Miriam, around the blood pressure reading and, a blood pressure of 180 and, believing that to be normal. And so not really, making any adaptations to diet or exercise or things like that. And so, and some sources of information, are different. So could you address that?
Yeah, that's a great question. It's you know why it's a great question? Because that blood pressure of 120/80 is kind of like on the border, right? So if we look at this definitions based from the 2017 guideline of ACC and AHA. It is already, it's elevated, right? Which is 120 to 129, 79 or below, or sometimes it's 80. So it's elevated. And if I could just share a funny story with my residency classmates, and we, at one point, we were all, our blood pressure were all measured, right? And it was all between 120 and 125. So we all laughed because we were young at the time, and we said, my goodness, we all have high blood pressure based on this guideline, right? So when someone is in that gray zone, one of the things that physicians would do is to have an individualized program or management with their patient, which is technically, right? Technically, based on the guideline, it didn't hit 130 yet. And so in this area where it's a gray zone, some of the things that physicians would work with would be the what's called the conservative measures, which is the area that we just talked about. What are those modifiable factors that you can carry out so that you can drop that to within normal? Now, here's the other thing. So that's one piece. The other piece is there are people that when they go to the office of their physicians, the blood pressure is high. Sometimes it's termed white coat hypertension. And sometimes if you were just running from the parking lot, and this happens all the time, here's a patient comes running in a hurry, stressed out because I don't want to be late for my doctor's office, and then I got to go back to work, and then I got to pick up my kid, and I got to drive my kid to soccer. So they're all hyper, there's a hyperstimulation with adrenaline. Adrenergic tone is high. And during those time, again, the blood pressure would be high. And that is why one of the suggestions is the ambulatory monitoring of the blood pressure, meaning not only do you measure that your blood pressure in the doctor's office, but one should also measure it at home, because when somebody is at home, it might actually be below the normal. And that's what happens on the elevated one. So the diagnosis is not going to be based on one reading. So in other words, there should be serial evaluation of that. And that's usually what I did when I was practicing outpatient. Now that I am practicing in inpatient, because I'm attending physician in 2 long-term care facilities, what I would usually do, especially people that I am not familiar with, people who we just admit, and they're not sure whether they really truly have high blood pressure, I would actually monitor their blood pressure for 30 days, every day, with different activities. Oftentimes, if they were just running from one end of the facility to the other, and they sit down and they look at the blood pressure is really high. And then I would get the average of that and look at once it hits 3, and of course, once it hits 140 over 90 and 3 times, I would treat them. But some of my patients would say, I don't want any treatment right now, Dr. Schwartz. I want to go through the conservative management. Because in medicine and surgery, there are 3 things that we often think about when you start managing people. Number 1, you start with conservative measures, unless, of course, there's a life-threatening issue. That's a different story. But when something is chronic, people in the outpatient setting would start with conservative measures. Then they would do a medical intervention, procedural intervention, or third would be surgery. So in that level of gray zone, it is that continuing to monitor, as well as looking at the modifiable factors, and then treating it more aggressively as you get more data.
I think the other thing that is really important that Dr. Schwartz pointed out is according to the guidelines, and over the years, the guidelines have changed. And so, and the threshold for what is considered normal and what is considered high blood pressure has actually lowered over time. So, as some of us, may be familiar with that 130 over, 90, as long as you're under that, you're good. Well, that's not true anymore, and that's based on research. So, you may have been told something once, but there's new guidelines that come out that are based on research that, we need to pay attention to because they've learned from that. Belly, do you want to add something to that? I can't see everybody.
Oh, okay. Oh, sorry. Go ahead.
Open question. Yes.
Last Thursday, when I went to the clinic here at St. Dominic. The Queen's here. You were the Queen's here. Yes, yeah, here Thursday. Last Thursday, I did check my blood pressure. The digital one. It came out to be 153/75.
153?
Yes.
That's pretty high.
Yes, and then after five minutes, it took again my blood pressure using the baby cuff. It came down to 135/76.
Well, that's why it's important for you to make sure that the cup fits you.
Yes.
You might need a smaller blood pressure because of your your slenderness. You might, as you said, the baby cup might be more appropriate for you. While everybody else, nobody here is obese. Physically, you really have to change your blood pressure. Remember the ones that we gave you, I think they fit you very well. But with you, Myrna, I think maybe, as you say, you're not insane, which is very good of you to realize that. So try to be consistent. If you have the baby cough, maybe you can be consistent with that.
I think the other thing that factors into this, okay. The other thing that factors into it is if you come in and people take your blood pressure immediately, just like Dr. Miriam talked to us about, and just like Mary Lou experienced today, she's running around and she gets in here, you need to rest for a little bit. At least 5 minutes, sitting with your feet flat against the floor. So all of us who have our legs crossed, not a good thing to do if you're going to get your blood pressure taken. And if you go to the doctor's office and they make you get your blood pressure immediately, which they do sometimes, and I always argue with them, then say, you know what, I want you to take it before I leave. Because that way you've sat for a little bit, you've talked to the doctor, your stress might be relieved based on, having talked to the doctor, but they take it when you leave. And mine is always a lot less because I've sat for a little bit, I've done some deep breathing. I've done some visualization, which helps, reduce the blood pressure. So, make sure that they listen to you, because, it's important that you take blood pressure under those conditions. Go ahead, Dr. Miriam.
Great points that are being brought up. And just dovetailing on what Marilyn had said and Dr. Felly, is that the measurement should be proper cuff, proper machine. And sometimes when you have something that you use at home, make sure that you cross-check it to what your physician has in their office, so that sometimes I actually ask my folks to use different machines. For example, and you pointed it out, which is they had to use the cuff, because if they would use something too big, then it might be a false reading. And if sometimes they would use something that is too tight, it might be so high a reading. And that's why it is important to have the situational awareness, as Marilyn was pointing out, as to when you got that blood pressure, where were you? What are the things that are happening? Were you stressed out? Were you just chill? You just finished going to mass, you enjoyed spending time with the Lord, you just prayed, and your blood pressure was taken. So there are many factors that can affect it, but the key is the consistency of it, that is being high, above 130 and 80. And then another thing that I wanted to share is on that video, on patient education and the basics of high blood pressure, what was one of the things that they mentioned is that you need to discuss with your primary care physician as to what is the good blood pressure for you. And let me share an experience why. Oftentimes, like in the past, I would volunteer as a on-call physician. I haven't done it in a while because I'm not teaching fellows at the moment. I'm also associated at UCLA. I teach geriatric fellows, their residents and students, etc. But when I'm active there and I'm teaching fellows, I am on call. And one of the questions I would have when I get a call in the middle of the night or 2 o'clock in the morning, 3 o'clock in the morning is I would ask them about the vital signs and I would ask them about the blood pressure. And when I ask them about the blood pressure, I don't ask, well, I do ask for what's the blood pressure right now. And then I ask for the range. And sometimes they would hear me say, please tell me what kind of blood pressure does this patient live in? In other words, does the patient sometimes go low at 90/60 and go up to 180, 30/80? And because there is a range that occurs. And the reason I do that is because if they needed a blood pressure pill and they're already 90/60, this is where that goes. The patient education we just saw. If they normally live at 90/60 or 100/70, I'm not just going to go ahead and start putting more blood pressure pills on them because that might be their norm. And so again, dovetailing on what my colleagues have already said is that the situation is very important as well to put into the big picture when you are talking with your primary care physician and having that record. It is so important.
So we have another question. Go ahead, Jean.
Miriam, hi.
Hi,
I
Jean.
have to thank Myrna for bringing up about the nurse that's here on Thursday. There is a Queen's Care nurse. They're community nurses and they're here because or through the health ministry for a number of years. And they will take blood pressures if you have a question about your blood pressures. They will check blood sugars. And if you have concerns about insurance or other types of healthcare items, conditions that you're concerned about, they're here every Thursday from 8 to 12. So anything else, Mary Lynn? Thank you.
I would say pass the word to the community that they're here between 8 and 12 on Thursday, because we want to make sure that we fill up their day and have enough patients every Thursday for them to be able to see. Pass the word. You don't have to be a parishioner. If you have a family member that needs the Queen's Care, that's fine. If you know somebody from the community that maybe doesn't have a physician, they can refer them over to the Queen's Care Clinic. But pass the word that they're here and it's free.
Wonderful. That's good service, and that's really important.
Emphasize what Dr. Schwartz indicated in her slides. Sleep apnea. How many of you know that you are snoring?
My husband says I don't snore, so I just want to go on record.
The only reason I'm bringing that up is you could have sleep apnea, and that's related to high blood pressure. And so if I were you, the next time you go to your primary care physician, mention it so that you will have sleep studies. Okay, that's something that is not emphasized generally with your clinic visit. So if you know you snore, check it out to determine whether you have sleep apnea. Okay, that is something that I have to mention and underscore, emphasize it to you. Next time you visit your primary care physician, be sure to mention to them that you have found out that you snore. And so you need suggest that you could possibly have some sleep studies. Okay, if you have Medicare, I think it's covered by Medicare.
Did you have a question?
Dr. Miriam mentioned about
One question at a time, please. Go ahead.
Dr. Miriam mentioned about not increasing the medication at certain. I just would like to know, because I've heard that once you're into blood pressure medicine, it will be forever. So what
So-
is your comment?
Sure. So the question, Miriam, is that, that she liked what you talked about in terms of, looking at the range of blood pressure and, individualizing, the treatment by patient. And what she had heard was once you're on blood pressure medicine, that you're on it forever. So she'd like you to comment on that. And if you wouldn't mind, if you could take your slides down, then we can see your,
Okay, my face,
face.
my little face.
that's your
Sure.
little face. We love your little face.
There's my little face. Yeah, great question. Great question. Yeah. Once, at least what I've seen in my practice and my colleagues' other practices, yes, very rare that once someone is started on an antihypertensive pill, that they will stop it after some point. And that's precisely the reason why some of those modifiable factors like the DASH diet, you're going to have a wonderful nutritionist talk with you about diet that can actually help reduce blood pressure. So if you can do all of those modifiable factors and then control your blood pressure that way, then well and good, right? The caveat is those that are not modifiable, those things that we cannot change. And I've seen it over and over and over again. And my husband and I talk about this a lot because he's a biochemist. He says the genes are a powerful thing. And that is why as people age, then they end up with a blood pressure pill, right? And yeah, many times, in more cases than not, I have seen that when people are given a blood pressure pill, they tend to use it and not come off of it. Because why? You have to be on the maintenance blood pressure level to control all of the bad complications or sequelae that can happen.
Thank you.
Thank you. So
You're
it
welcome.
looks like our line dance instructor is here, and I guess Philly's given him some instructions too. I think what we'll do, Dr. Miriam, is would you guys like to have her back to do a question and answer another time? She's coming next week, although we're not sure if she'll be able to from Ireland, okay, because it'll be 11 p.m. for her, but she's going to try. And if not, we'll have a recording of her lecture next time. But would you like to have her come back and do some question and answer?
Can we just write our questions and throw it to her, and then we will just she will just answer.
They want to know if they can send me and Dr. Felly the questions, and you can give us the answers, and we'll send them back to them.
I don't know whether I have the time to do all of the emailing, so it would,
Yeah,
if you
all
guys,
right.
if y'all don't mind.
Better to do in person. Yes,
If
one
we can
last question.
One more question.
Yes, go ahead.
What's the diet sold for the Filipinos?
Okay,
What is All right, we're gonna have
I gotta
great
say, I love my Filipino food. Oh my goodness, we just went to Arco and bought a whole bunch of food there yesterday.
Oh, Miriam,
So-
do not tell us that.
I know, I shouldn't tell you that. I love Filipino food, but
I'll let her answer, but just know we have a dietitian coming 3 times, to
That's
talk
great.
about Filipino diet and, culturally pleasing and comforting foods, right? I can't tell you how happy I was to have pancit last week. I haven't had pancit in like years. And we're also going to have our Queen's Care nurse come and talk about portion control and how to help with that. So know that we'll have a lot of detail for you, but go ahead and Miriam and, just make a statement about Filipino food, please.
Yeah, we decrease when I cook. I would decrease the amount of salt that I put in there. I would also decrease the fat on there, and I would also use olive oil. I would do a lot of boiling. I would, even if I would cook pinakbet, or my husband loves mung bean, mungo. So with that, I use olive oil and I use low fat turkey, and then I use that for it. So we can use ingredients that are low fat, and that's what I use for to decrease the amount of fat and also decrease the amount of salt. I barely use salt actually in my Filipino food.
Yep.
That's my goal.
Okay, that's the goal, Miriam.
Great
You
goal.
hit the golden answer.
Yeah, if they have any questions, Marilyn, they can give it to you. If I have short answers or resources, I can lead them to the resources. But if it's a more nuanced answer, that's when I'm going to have an issue. But if I can just lead them to a resource, happy to answer those questions.
Well, and you and I can actually talk on the phone and I can dictate,
Yeah.
you know, so you don't have to spend a lot of time typing too. So
Yeah,
she's going to
so-
be leaving for Ireland, you know, next week. So if you have questions, you have Dr. Felly's email. I think that, you know, go ahead and send it to Dr. Felly. We'll figure out how to get the answer to you, but we'll see if we can bring her back. Thank you, Dr. Schwartz. This was
Thank you,
wonderful.
everyone. Thank you. Enjoy. Thank you for being part of Linda. Thank you. Bye-bye.
Bye-bye.
Bye.
Thank you.
Thank you.